I'm Paula Gray, I'm a haemophilia nurse specialist at Manchester Royal Infirmary.
So I'm Anna Farrell, I'm a haematology nurse specialist at Bristol Children's Hospital.
I'm Carol Lockley, I'm one of the nurse specialists at the Sheffield Adult Centre.
I'm Jenna, I am the adult clinical nurse specialist at St Thomas's Haemophilia Centre in London.
My name's Kathy Harrison, I'm an advanced nurse practitioner from Sheffield Haemophilia Centre.
I'm Deborah Pollard and I am the lead nurse specialist at the Royal Free Haemophilia Centre in London. I was on the board of trustees of the Haemophilia Society that voted for running the bid to come to Glasgow for WFH. When I did that many years ago, I never anticipated that I'd be in here running the treatment room, although that's part of the deal.
I work in adults. The people seen here are young people, but with my adults' problems. The children, the young adults we have in our centre have got none of the problems that these people who've used the treatment room have got. And I think they need to would benefit from seeing people of their own age with problems and not access to treatments. It might make them a bit more understanding for why we ask for records, why we ask for them to do the prophylaxis regularly to prevent damage.
So the major difference for me was that it was all adults to see, and I haven't looked after adults for probably the past 25 years. I think also talking to other people, obviously it was lots of patients who don't have access to clotting factor in their countries of origin. We were seeing a lot of gentlemen that had long established bleeds into joints, so there's quite a lot of joint damage and things. And I think it did, for me, it just highlighted how fortunate we are that we have access to good quality products here, but also it did make you aware that we need to think about what we're doing.
I've met an awful lot of people for whom I have the hugest amount of respect in terms of the patients who've come all across the world, often with really severe disabilities of the kind that we really don't see much in the UK anymore. It's like turning the clock back 50 years in the UK, and yet they've had the courage to come often without any English or with very minimal English across the world just to take part in this, and to be able to do a small amount to contribute to their well-being this week has been incredibly important and a real privilege, actually, at risk of sounding really corny.
The patient's the same. Part of it's like a busman's holiday. We're doing the job that we do anyway. The things I've found different is that the way that I work within the NHS, we have a lot of resources. We can prescribe a certain amount, we do levels, we can be very thorough. And here we've had to be conscious of the amount of factor we've got. So we've had to sort of think about that, which is a different way of doing it.
It's been fantastic to meet patients from across the world and see their experience of living with bleeding disorders. We've seen a whole host of bleeding disorders, from haemophilia, von Willebrand's disease, severe factor 7 deficiency, and it's interesting to see the coping strategies of people living with bleeding disorders who don't have the same access to treatment that our own patients do here in the UK. It's been very emotional. I think it's been very rewarding. I think we've made lots of new friends, which is really lovely. I think it's been interesting to see that you can communicate with people even when you have language barriers. People are just so pleased that there's treatment here, and that the nursing and physio teams have been so supportive and kind to them, and I think it's just been a really rewarding experience.
I have seen such totally different patients. So the young men I've seen at Congress are young men whom in the UK would grow up with high dose prophylaxis and would have mainly pristine joints. We're seeing here 20 to 25-year-olds with multiple joint arthropathy and some really significant joint deformity. And it has been very difficult to act in the same manner that we would at home. We maintained all of the same assessment skills that we would in our own centres, but we are seeing so much more in the way of bleeding and pain and disability.
My experience in the treatment room was just seeing young patients with terrible joints and swollen joints that we wouldn't generally see in this country because of the benefits of prophylaxis. I was seeing these, young men hobble in with knees that don't bend, elbows that they can't touch their face with, and in quite a lot of pain, and trying to sort of advise them on some self-management because most of them have never even seen a physio before and probably don't even know how physio or exercise or anything could help them. So that was sort of what I got out of the treatment room the most.
The degree of joint damage on younger patients or even the older patients with every joint affected, the resilience shown to travel here from wherever with those joints and to be here and to do that, I kind of think is more telling of the patients. They're clearly the people that are trying to push the boundaries and get some more better treatment for their fellow patients. So yeah, it's been a humbling experience as well as been quite a lot of fun as well.
It's been nice working with people that you know by sight from meetings and everything, but then actually it's like a new team coming together and just getting on, and everybody's worked hard. Just like a proper team, as if in some ways as if we've always done it. We might never have worked with somebody, you just see them at meetings, but we've literally come together as if we are just one team.
It's been fantastic. I've really enjoyed that. So these are people that normally we only ever see at things like the Congress or at our HNA meetings, and then to actually be practically working with them, doing clinical work has been great. And I think all of us have actually said we've really enjoyed doing the clinical work, because with home treatment and such like, I don't often treat people. I'm teaching parents how to treat people. I don't often do it myself. So I think there's been a really good team working. I've really enjoyed working with other people.
Yes, I've done a few sessions here. I was a bit apprehensive beforehand, but it's actually been a lot of fun. It's been really nice to work with other haemophilia nurses that I know but I don't work with.
And I think working with other nurses from throughout the UK that we don't get to work with on a day-to-day basis, that we only meet networking, has also been fantastic, because actually you see a whole different side of people in clinical practice.
So that was one of the big unknowns, really, how it would be working alongside people that we've only met. Obviously, we're all quite a close-knit group, but we've never, any of us, worked together. And it's turned out to be the most amazing experience. Nurses have come from all over the country with very different levels of experience and knowledge, have really pulled together. We've had teams of nurse prescribers, and we've had teams of the other nurses coming in to treat the patients. It's been fantastic. At busy periods, people have just come along because they've heard it's busy and come to help out. And it has been a really cohesive group of fabulous nurses, of which we're really proud.